Bismillah ar-Rahman ar-Rahim. In this lecture, I will talk about indications of splenectomy. Indications of splenectomy. Splenectomy may be performed for the following conditions. The first indication of splenectomy is blood disorders, which may include the first subtype of blood disorders is idiopathic thrombocytopenic purpura or ITP in patients who fail to respond to medical treatment. Idiopathic thrombocytopenic purpura is a condition where the body destroys its own platelets. The second subtype of blood disorders is hereditary spherocytosis. In this genetic blood disorder, the red blood cells are larger than normal in size and break down when they pass through the splenic blood vessels. The third subtype of blood disorders is autoimmune hemolytic anemia. In this group of blood disorders, the body destroys the red blood cells faster than they are formed, resulting in anemia. The fourth subtype of blood disorders is other blood and bone marrow disorders like hairy cell leukemia, chronic idiopathic myelofibrosis, and splenic lymphoma when indicated. The second indication of splenectomy is enlarged spleen, where the spleen sequestrates excess blood cells and destroys them. The spleen may be enlarged in the following conditions. The first subtype of enlarged spleen is typical splenomegaly due to infectious like malaria, Kala-Azar, or visceral leishmaniasis or schistosomiasis. The second subtype of enlarged spleen is Felt's syndrome, which is characterized by an enlarged spleen, low white blood count or neutropenia, and rheumatoid arthritis. The third subtype of enlarged spleen is idiopathic splenomegaly, where the cause of the enlarged spleen isn't known. The third indications of splenectomy is a rupture of the spleen, which may occur due to a blunt trauma, for example, due to a blow on the spleen. We are seeing here case rupture spleen, but we are seeing here cases of blunt trauma of the spleen. The second subtype of rupture of the spleen is penetrating trauma. For example, due to a knife piercing through the spleen. We are seeing here case stab spleen. But we are seeing here case rupture of the spleen, and we are seeing here splenic laceration. The third subtype of rupture of the spleen is a spontaneous rupture, which may occur in disease condition like malaria and infectious mononucleosis. We are seeing here case of malaria, but we are seeing here spontaneous splenic rupture in infectious mononucleosis, and we are seeing here case of spontaneous splenic rupture in malignant lymphoma. The fourth subtype of rupture of the spleen is trauma during surgery on the neighboring organs. Patients with a rupture of the spleen with low blood pressure require emergency surgery. We are seeing here cases of splenectomy post-trauma during surgery. The fourth indications of splenectomy is splenic vein thrombosis, where the drainage of blood from the spleen is obstructed by a clot in the splenic vein. We are seeing here normal splenic vein, but after 8 days there is a clot in the splenic vein. The fifth indication of splenectomy is aneurysm of splenic artery. An aneurysm is a localized ballooning of an artery which can pierce at any time, resulting in instant death. We are seeing here many cases of aneurysm in the splenic artery. The sixth indications of splenectomy is large cysts of the spleen, which may be due to parasitic infections, trauma, congenital, or present at birth. We are seeing here case of parasitic infections in the spleen. This case called hydatid cyst in the spleen. But we are seeing here splenic trauma, and we are seeing here case of congenital splenomegaly. The seventh indications of splenectomy is cancers of the spleen, which include lymphoma to stage the cancer, fibrosarcoma, angiosarcoma. The eighth indication of splenectomy is abscess of the spleen. It must, however, be remembered that splenectomy is not done for all patients with the above conditions, but is only done when it is really required and the benefit of removing it far outweighs the disadvantages of not having a spleen. We are seeing here many cases of splenic abscess. In this slide, we are seeing here many indications for splenectomy. For example, traumatic, rupture after blunt injury to the abdomen, hematological, immune thrombocytopenia, hereditary spherocytosis, for example, malaria, schistosomiasis with other viscera, radical gastrectomy, pancreatectomy, miscellaneous treatment for gastric varices, treatment of splenic artery aneurysms, treatment of splenic cysts or tumors. I will talk now about testes before splenectomy. Blood tests, CBC, PT-INR, blood group, liver function, kidney function, electrolyte levels in the blood. Bone marrow aspiration and biopsy examination. Endoscopic to check for dilated blood vessels or varices in the upper digestive tract. Abdomen ultrasound, CT scan for the abdomen. We are seeing here case of CT scan splenic abscess, chest X-ray, ECG or electrocardiogram. Overwhelming post-splenectomy infection or OBSI is an overwhelming infection with meningococci, pneumococci, or Haemophilus influenza. It is therefore necessary to vaccinate individuals before the surgery to prevent the infection. We are seeing here timing of immunization, for example, 14 days before selective splenectomy, but we are seeing here immunization timing 14 days after emergency splenectomy. Treatment surgery for the spleen. We are seeing here removal the spleen with laparoscopic or dissection by linear stapler to the spleen for removing the spleen, but we are seeing here removal spleen with open surgery. Now I will talk about complications of splenectomy. Post-operative pain, excessive internal bleeding, injury to the pancreas. In this slide, we are seeing here early complications of splenectomy, for example, hemorrhage, injury to the stomach or splenic flexure, pancreas, but delayed complications of splenectomy, for example, fistula from stomach, pancreas, subdiaphragmatic collection, thrombocytosis, thrombotic complications, infection, venous thromboembolism, other complications post-splenectomy, collapse of the lungs. We are seeing here case of left upper lobe collapse, failure of the bowel to move following surgery. This case called paralytic ileus. We are seeing here case of paralytic ileus. In the end of this lecture, thank you for all.